this young lady, her name is Carly Fleischman. I actually reached out to her to try to see if I could get her to give us some advice on treating patients in the field. Unfortunately, she wasn't able to get back to me due to her busy schedule. But this is Carly's Cafe. Put her there. All right.
I can't wait for coffee. Oh, hello, barista.
What do you girls want?
Skim soy latte?
Taryn, soy can't be skim.
Hot chocolate, orange juice.
No, Dad, I want a coffee. Hot chocolate? Great.
So, I was thinking of going to Sarah's later. Could you give me a ride?
Yeah, sure. Are you cool with taking your sister?
Yeah.
Wait, what? I have my own plane.
Carly.
Okay, I'll see you tonight, okay?
Carly. How can I help?
All right, so that was a short look at a typical outing for somebody with autism. Carly does have a more severe form of autism, but she wrote that video with her father. So this is actually Carly's point of view of the world. She is nonverbal, and she does communicate by typing everything that she wants to say. So here's another short excerpt where Carly explains stimming and kind of a little bit of advice to the medical community.
And one thing we were hoping to do, and Carly agreed to this before the show, is have Carly help us answer some questions about autism and what she's experiencing. If you're a parent out there with an autistic child, or you know anyone with autism, we're going to try to give you a brief glimpse into what someone with autism deals with. So we asked Carly these questions before the show because it takes Carly a little time to type out the answers. So Dr. Shears, why don't you ask Carly the first one you had?
So Carly, in the autistic community, there's a word called stimming that a lot of people use. What is that?
In order to answer this question, I have to explain what a stim is. My experience is that most doctors don't even know what a stim is. Most people are able to be in a room and block out sensory input and focus on the person who's talking to them. For someone with autism, our senses come at us all at once, and we do not have a filter that allows us to block sensory input. A stim, as doctors call it, is when someone creates output to block input. We create output in order to block out the ongoing input. Typical stims are covering one's ears and humming. This allows us to block incoming sounds and change frequencies that we are receiving. I would like to point out that most people in the world stim. How many of you doodle on a piece of paper when you're talking on the phone? How many of you twirl your hair or twiddle your thumbs or tap your feet when talking to somebody? That is all stimming. You may see more people with autism do it because our stims don't look socially appropriate.
And that's Carly's voice. And no one else could explain it to us like that, Carly. And that's the power that you are providing for everyone here, because I can tell you that I have never understood autism like I do right now.
Yeah, I agree.
Just from hearing your response to that. So Carly, I was going to ask you a Twitter question, if that's okay. You
So
still-
wait, before you ask it, should he follow you on Twitter? Yeah? Yeah.
Will you follow me on Twitter?
Will you follow? I think she's following you on Twitter.
How about, can we take a picture together and then you can show me how to post a picture on my Twitter? Because I don't want to do that yet.
Deal? Pinky deal?
That's a pinky
All
swear.
right. Thank you.
Yeah, you're welcome.
So you have to show me how to do it. Okay, Carly. If there was one thing you think everyone should know about autism, what would it be?
That people who are on the autism spectrum have different gifts and talents that need to be molded. We're all capable of amazing things and need people to believe in us in order to shine. There are many people with autism holding important jobs and doing the most incredible things you've ever seen. We just need more people to encourage us and teach us how to reach our full potential.
That's great. So Carly, I'm pretty sure you can do anything you want in this world. And I think and hope that everyone here today and everyone at home watching will realize that even though you may not always understand what someone with autism is going through, they may understand a heck of a lot more than you would ever imagine. Carly, thank you so very much for sharing your story. Dr. Thank you for all you're doing. Howard, thank you as well. And of course, if you want to know more about Carly's story, go to thedoctorstv.com. You can also read more of Carly's answers there. We'll have a link to her.
All right. So that was Carly kind of explaining stemming, and everything that Carly said through the electronic voice, she typed herself. I really think that this illustrates that just because you arrive on scene and you think that your patient is GCS of 3 or for some other reason has no earthly idea what's going on, they may in fact understand everything that's going on as good or better than you do. So that's something that we should never forget as providers. All right, so moving into exam and assessment. Often agitation is the most obvious presentation, as we saw in some of the short clips in the second video. Carly's no exception. She does have moments of agitation and anxiety. So that's what you're most likely to see in a patient with the more severe forms of autism. Whenever this happens, you must consider medical and emotional causes. So medical causes could be anything from a sore stomach to trauma to anything really. Emotional causes could be just a small change in their life. Maybe they have a new therapist or a different teacher, or a little bit larger change. Maybe a pet has died or something like that, and that's caused some agitation. Your best bet is to work closely with the caregivers, because more than likely you really don't know the patient. The caregiver spends all their time with the patient. So the caregiver is pretty much going to be your new partner for this call. You're going to work with them pretty closely. You're going to consult them on just about everything. Getting a careful, detailed history is crucial, because oftentimes if these patients are nonverbal or have difficulty communicating, and trying to find out exactly why they're having a bad day is often not easy. So the caregivers can advise on communication if there is a method, or if the method is not easily understood, then they're able to translate. A lot of times these patients can have atypical responses, so they may have very little reaction to an open tib fib frac, but when you go to take their blood pressure, they may have a increased agitation event, just because of the texture and the sound of the cuff agitates them in a way that they're not happy with. So we can see that in our treatment that could pose several hurdles to overcome. You may not be able to reason with the patient or comfort the patient with appropriate explanations or reassurances. Some, as we saw in the video, the Carly's Cafe video, her dad was trying to talk to her and trying to comfort her when she was having an agitation event. And he really wasn't able to, because of all the sensory input that she was having at that time, and everything that was going on. There really wasn't a lot that he could really do. So, let's see. If exam, assessment, and history show no findings, consider emotional causes. So this is where your caregiver is going to come in, like changes in their life could cause some of these emotional agitation events. It could be small or major life changes, as we discussed. Emergency scenes are loud, bright, fast-paced, and hectic for regular patients and for us. I don't think you're going to find a whole lot of people that are going to contest that. Nearly every aspect of emergency response can cause or increase an agitation response. I think with what we've covered so far, that's pretty obvious. Unless immediate life threats exist, make every effort to decrease and eliminate as many sources of stimuli as possible. So we want to make sure that we don't have our communication radios blaring, or we want to try to minimize lights and sirens the best we can. Any extra sources of stimuli could agitate the patient pretty heavily. So systematic desensitization may help. A lot of times you see this with the younger pediatric patients, where if the situation allows it, kind of take your time. Don't rush in there trying to be Ricky Rescue.